I walked in the door and the person on duty there took one look at me and sent me right into the emergency room, and next thing I knew I was on a table and the doctors and staff were hovering around me.
As we were getting an IV established, I was talking to Ken and Catherine and saying, look, you know, you're actively having a heart attack right now. One of the vessels that operates your heart is blocked.
They were, you know, talking to both of us, and Dr. Look was explaining exactly what was going to happen in the cath lab.
And all of a sudden, Ken's eyes fluttered and he stopped talking to us.
At which point the nurse said, he's coding.
So we sprung into what's called a code blue situation.
Then everyone started running, and they ushered me out of the room.
The CPR began immediately because I started that.
So I was just standing outside, frantically wondering, you know, what was going on, and I heard the nurses saying, we have no pulse, doctor, 1, 2, 3, we have no pulse, doctor, and this just kept going on and on.
I knew that we had good oxygenation going on. I knew we had good circulation going on with the CPR, so we stuck to it.
They kept going on, and about 10 minutes went by.
My understanding, I've heard from many others, that customarily ER teams don't go that long in attempting to resuscitate. After 4 or 5 minutes, you know, it's generally the end of the case.
Right after one of the shocks, we saw the heartbeat come back as it should be. Sort of classic right out of Hollywood on the monitor. I think you just know, it's part of the art of medicine, is you know when to stop and when to continue. And that was, I think all of us knew. I would have been prepared to work on Ken a lot longer than I even had to.
I just thanked him for the ER team's perseverance in really not giving up on me. They saved me.
Ken Weeman's road to recovery began that night.
And so we stabilized a critical situation, but the care and healing is upstairs.
The first stop upstairs was the catheterization lab, followed by the intensive care unit, and finally a healing stay in the heart and vascular unit. The excellence of all these services is why St. Helena Hospital has earned a reputation as one of the best coronary care facilities in the nation. But excellence in medicine is not a static plateau, nor can a hospital genuinely serve its population by offering excellence in just 1 or 2 areas. So in 2006, the hospital launched a capital campaign, resulting in the construction of the Johnson Pavilion, which houses both the Martin O'Neill Cancer Center and the Trinchero Surgery Center. The new cancer center affords Napa Valley residents the same care they would expect in a large metropolitan facility, including radiation therapy, chemotherapy, and other services in a setting designed to make the patient experience as serene and healing as possible. Downstairs, the addition of 2 new surgery suites and expanded patient recovery area has made possible the groundbreaking work of the Kuhn Joint Replacement Institute. The Institute has made St. Helena a destination hospital, as patients from across the country are drawn here for the advanced surgical techniques, which provide better joint implants and greatly reduced recovery times. Meanwhile, St. Helena Hospital continues to excel in meeting the general health needs of the communities it serves. The emergency room handled 7,000 visits last year under its no-wait policy, which guarantees treatment to begin within 15 minutes of arrival. St. Helena's physicians performed more than 5,500 inpatient and outpatient surgeries in 2010. The clinical lab performed 255,000 lab tests and 69,000 diagnostic X-ray and respiratory procedures in the past year. In keeping with its nonprofit mission, the hospital has provided over $17 million in charity and uncompensated care during the past 3 years. Nationwide, between 2008 and 2011, hospitals have seen their revenue shrink by an average of 1.2%. During this same period, St. Helena Hospital Region has experienced a net revenue increase of 57%, with an additional 36% forecast by 2013. With this growth comes pressure related to capacity, infrastructure, and the constantly evolving demands of modern technology. Because the community has so tangibly benefited from the results of past philanthropy, it is appropriate now to take the next steps toward maintaining and expanding St. Helena Hospital's commitment to excellence in every area of its operation. For 2011, the hospital has identified 6 critical areas in need of attention. These 6 projects will be funded through the shared resources of community philanthropy and funds from the hospital's parent corporation, Adventist Health. The 6 areas are building a new family birth unit, expanding the heart and vascular wing, expanding the orthopedics wing, expanding the intensive care unit, updating the patient rooms and public areas of the hospital, and modernizing the sterilization and delivery of surgical equipment. In today's society, birth has evolved into a true family experience. With multiple family members present in the room, there is scarcely space for the monitoring and patient care equipment, which didn't exist when rooms barely 200 square feet in size were deemed adequate for delivery.
And right now, we're just all bumping into each other.
The present facility also lacks a dedicated surgical suite for cesarean or other high-risk deliveries. Currently, mothers in need of cesarean delivery must be wheeled through a public corridor and taken 1 floor down to the operating rooms.
It's a difficult thing to do and an impossibility if we have to do an emergency C-section, which we do in the room where we're at, or in this small closet of a room.
And now the state of California has mandated that the entire unit must be closed unless it is updated to meet current standards. The new facility will remain on the 5th floor, but move to the east wing in space formerly occupied by cardiovascular services. It will offer 6 labor and delivery rooms nearly 50% larger than current spaces, each equipped with a private bath and shower. A new on-site surgical and delivery room will handle all the needs for scheduled or emergency cesarean deliveries. The new family birth unit will also include a nursery with 6 bassinets, a sleep room for physicians, and a welcoming patient and guest center. St. Helena Hospital performs more interventional cardiac procedures, such as angioplasty and stent placement, than any other hospital in Napa and Lake counties. As our reputation for state-of-the-art service grows, St. Helena Hospital must stay ahead of the curve in our ability to offer the most comprehensive care.
The heart and vascular unit continues to be full all the time, so we definitely do need more beds. The current HVU is not in the most convenient location because it is far away from the operating rooms, it's far away from the catheterization laboratory, it's far away from the intensive care unit.
The plan for a new heart and vascular wing calls for relocating to the 5th floor in the space vacated by the Family Birth Center and orthopedic services. The new 9,200 square foot wing will house 35 beds, a nearly 50% increase over current capacity. When Dr. Thomas Kuhn joined our staff in 2009, he performed 100 total or partial knee replacements at St. Helena Hospital. In 2010, with the addition of Dr. Adam Friedhan and Dr. John Vallivas to the Institute, the total number of joint surgeries at St. Helena rose to 800. In 2011, that number is expected to nearly double to 1,400 procedures. As word of the Kuhn Joint Replacement Institute's excellence has spread, St. Helena Hospital has become a destination for patients across the country and around the world. To manage a patient flow soon expected to top 2,000 joint replacements annually, we need a redesigned orthopedics wing with 14 beds, 2 VIP suites, and a welcoming client and guest hospitality center. Our hospital has seen a 56% increase in acute inpatient volume over the past 2 years. Due to our limited capacity in the ICU, patients requiring critical care have sometimes had to be directed to other facilities. The 2011 Capital Campaign Plan calls for the creation of 2 new ICU suites featuring the latest technology and monitors. A new nurses station will alleviate overcrowding in the current station, leading to a more efficient operation and raising the standard of patient safety.
We need to upgrade our intensive care so we won't fall behind and be able to provide the best care that we are proud to provide in our other areas of our system and healthcare services.
The fresh and welcoming decor of the newest areas in the hospital reflect the current recognition that physical surroundings play a key role in the healing process. Still, many of the areas where patients and their families spend time are located in buildings more than 60 years old. Project Transform was conceived to ensure the consistency of the patient experience, irrespective of which part of the hospital patients find themselves in. The changes in store for older patient rooms include resurfacing floors and tile, adding new window coverings and furnishings. The new lobby will greet patients and visitors to the hospital in a manner indicative of the care they can expect within. Project Transform calls for replacing 210 windows with high-efficiency double-pane glass, increasing thermal efficiency by 50%. The west exterior will get new awnings. Patients with views of the valley will better appreciate the therapeutic setting of St. Helena Hospital. As surgical volumes increase, one of the attendant challenges is keeping an adequate supply of sterilized surgical tools moving through the system. Currently, every instrument passes through a central sterilizer, which no longer has the capacity to meet our surgical loads. This can lead to delays in OR start times and a potential shortage of optimum tools for each particular case. The solution is a new STERIS sterilizer system, coupled with a new computerized inventory system for just-in-time distribution of instruments to the proper surgical suites. The new system will increase throughput by 400% with greater energy efficiency and fewer chemical byproducts. Together, funding these improvements will position St. Helena Hospital for the next decade of growth and help ensure our patients not only the best outcomes, but the best experience during their stay.
I think as a community, we are blessed to have a facility such as St. Helena Hospital. Close proximity, and when you get to the facility, it's for a small hospital, it has so many specialties, and in my case, it was the exact specialty that I needed. You know, although I was nervous, I was also comforted by just looking at the staff and the equipment and feeling very fortunate to be there.